I'm Uzair.
And it's our cranial nerve project. I'll be observing cranial nerve 1, which is the olfactory nerve. This is the sensory nerve that's responsible for the sense of smell and exits from the cerebrum.
Okay.
I want you to close your eyes and block out one of your nostrils. I'll present you with a scent, and I want you to identify what it is.
It smells like hand sanitizer.
That's correct. What I'm observing is the ability to correctly identify the scents that were provided. Any loss of smell or anosmia could indicate that you have damage to your olfactory nerve, which can be caused from head trauma or degenerative disease such as Parkinson's disease.
Okay.
Now I'll be assessing cranial nerve 2, which is the optic nerve. This is the sensory nerve that's responsible for vision and it exits from the cerebrum.
Okay.
Can you read the smallest line on this Snellen chart?
F, G, I, T, Z, and the bottom W, Y, F.
Okay. Next, I want you to follow my finger, but don't turn your head. Using your eyes, just follow my finger. Do you see my finger?
Yeah, peripheral vision. Yeah. My peripheral vision.
Point of that was to see your clarity of vision and if your peripheral visual fields are working perfectly.
Okay.
Any blindness or visual field effects could indicate that you have damage to your optic nerve, which could be caused from strokes or glaucoma. Now I'll be testing cranial nerves 3, 4, and 6 together, which is the ocular, trochlear, and the abducens nerves. Cranial nerve 3 is the motor nerve that's responsible for controlling most eye movements and pupil constriction. It exits from the midbrain.
Okay.
Cranial nerve 4 is the trochlear nerve, which is the motor nerve exiting the midbrain and controls downward and inward eye movements.
Okay.
And cranial nerve 6 is the abducens nerve, which is the motor nerve that is responsible for controlling the lateral eye movements, and that exits from the pons. I want you to follow my finger as I move it in an H pattern. Looking good. Now I'll shine this light at you just to see if your pupils are constricting properly. Any abnormalities such as diplopia could indicate that these cranial nerves have some damage to them. Okay. Now I'll be testing cranial nerve 8, which is the vestibular nerve. The sensory nerve is responsible for hearing and balance, and it exits from the pons medial junction.
Okay.
I'll play the sound, and I want you to let me know when you hear it. Okay. Now I'd like you to stand up. I want you to close your eyes and put your arms across you. Okay. I want you to stay like that for 10 seconds. Try to stay as steady as you can. What I'm observing is if you could hear the noises properly and on time, and if you are having any unsteady movements, if you can keep your posture balance. Okay, you can sit down. Any hearing loss or unsteady stance could indicate damage to your vestibular.
I'm now assessing cranial nerve 5, the trigeminal nerve. This mixed nerve is both sensory and motor, and it exits the pons, and it controls facial sensation and chewing. So can you tell me if you feel this light touch on your forehead?
Yes.
Cheek?
Yes.
Jaw?
Yes.
All right, next I would like you to clench your jaw tightly, and I'm going to assess your muscle strength. Okay, I'm palpating the masseter muscle here to see motor function during jaw clenching, and I'm ensuring the patient has intact facial sensations. And the trigeminal neuroglia, or sensory loss, could indicate damage to this nerve. I think that's like any abnormality that can arise. I will now be assessing cranial nerve 7, the facial nerve. It has both sensory and motor functions, and it exits the pons, and it controls facial expressions and contributes to taste sensation, like on the front of the tongue. So I would like you to perform a few facial movements. Can you first please smile? In the patient smile, I'm ensuring that there's no drooping on either side. Can you now puff out your cheeks? I'm also looking for fullness and like the ability to hold air in without like leakage of air. And can you now close your eyes tightly? I am assessing whether there's equal closure on both sides. Damage to this nerve can result in like facial drooping or weakness on one side, otherwise known as Bell's palsy. I will now be assessing cranial nerves 9 and 10, the glossopharyngeal and the vagus nerves. These nerves are both sensory and motor again and exit the medulla, and they're involved in swallowing, speech, and the gag reflex. So can you please say ah while I observe the movement of your soft palate and uvula? I'm assessing that there's symmetrical elevation of the soft palate and ensuring that the uvula is remaining at the midline. I'm also listening for clarity in the patient's speech to rule out any like slurred articulation. And damage to this nerve can result in difficulty swallowing as well as slurred speech. I will now be assessing cranial nerve 11, the accessory nerve. And this motor nerve exits exits the medulla and spinal cord, and it controls movements of the shoulder and neck. So can you please shrug your shoulders and resist against my resistance? So I'm checking for equal strength on both sides. Can you now turn your head against my resistance? I'm checking for adequate resistance and symmetrical neck movement. Can you please do this side as well? Perfect. Weakness in shoulder shrug or head turning suggests that there's a dysfunction of like the trapezius or sternocleidomastoid muscles. And lastly, cranial nerve 12, the hypoglossal nerve, is a motor nerve that exits the medulla and it controls tongue movement. Can you please stick out your tongue and move it from side to side? Okay. As the patient sticks out their tongue, I'm checking for midline positioning of the tongue as well as smooth and symmetrical motion of the tongue. Again, damage to this nerve can cause tongue deviation on the affected side and then cause impaired movement.